good evening, everyone. Thank you for coming today. Today we'll have our second panel, which is the future of pharmacy through technology. But first, let's introduce myself and our lovely panelists. So my name is Martina. I'm a foundation trainee pharmacist and a recent graduate from Swansea University. And I'm also the president of the British Pharmaceutical Students Association, which is an association that basically represents pharmacy students and trainees across the UK. Yasmin, do you want to give an introduction?
Yes. Hi everybody, thank you for having me today. So my name is Yasmin, I'm a content creator, a pharmacist, a biotechnology founder, and I run the Pharmacy podcast.
Wow. Yeah, I'm Amar, I'm a doctor by background, but I work at Tandem. Tandem is an AI scribe. We're an assured scribe, the #1 in Europe, and I encourage everyone to try it out.
Hi everyone, my name's Tayo. I'm a community pharmacist by background. And I'm also the co-founder of MediReach, which is a booking platform, and I'm also a health content creator.
Hi, I'm Thorin. I'm a pharmacist, a lawyer, and I pop up on your TV and talk about healthcare.
Hi, I'm Komal. I'm one of the co-founders of the Female Pharmacy Leaders Network. The network is designed to support women in pharmacy to reach leadership positions.
Lovely. So now that you know our panelists, let's get started with the questions. So first question goes to you, Yasmin. So with your clinical coding background, how is data and technology already changing how pharmacists approach patient care and clinical decision making?
This is such a great question because I was literally just having a chat with earlier today, and essentially it's basically leveraged the way that we are able to deliver patient care. Now with products like Tandem, but this is not an ad, and other ambient voice technologies and other technology products out there, we are now be able to have more patient contact, more focus on the actual clinical component rather than be burdened with admin. In addition to that, we can now highlight with data through our PMR systems, our hospital record systems, we can actually highlight the patients we need to see first, we need to call, we need to bring into our pharmacy. So honestly, it's just basically leveraged the way that we deliver care now.
Thank you. And Amar and Teo, so you're both working at the forefront of pharmacy technology. Can you share a specific example of how your solutions are solving real problems for pharmacists or patients today?
Yeah, I can go first. So at MediReach, we've developed a booking platform for both pharmacies and patients to use. So what we found is that a lot of patients still don't know about all the services that pharmacies can provide. So we're giving greater access and convenience for patients to book through our website. So it connects patients directly to all the services, including NHS and private services. So that stops, your normal typical pharmacist from being bogged down into, patient management, booking management, and just focusing on healthcare services. So yeah.
Yeah, at Tandem, we found that pharmacists are generally spending much more than the average 40% that we find in GP on admin. I don't think that's really what you want to be doing. You didn't train to do the admin, you trained to see your patients, to give better care. So we're trying to give you back that time, whether it's time after your session, whether it's time of the weekend that you want to be spending with your kids, whether it's time to see more patients or make more money, I'm not really sure, but the main point is we want to give that time back to you. We're already working with a lot of GLP-1 providers, with digital health providers, but I really want to see whether there's a gap in pharmacy first, in community pharmacy, for patients that you're seeing regularly for a set number of conditions, whether you want to write your GP notes straight away, whether you want help with submitting to the MYS, all of that can be done through Tandem.
So it's clear from both of your companies that efficiency is the key goal and key message. Great. And Thorin, from a regulatory and professional perspective, what should pharmacists understand about working in an increasingly digital healthcare environment?
So I support pharmacists buying and selling pharmacies. I support them in inquests, which obviously you don't want to have to attend, but ultimately if we don't get things right at the start, and we all talk about that Swiss cheese model, we need to make sure that we're always thinking about the impact on patients. And I think if you approach it with a patient first point of view, whenever you do something, you will get the outcome in the end, a positive outcome. Just in terms of regulation, there's a lot of changes coming up with regards to medical devices. So that's going to be a huge amount of change that some of the people that I support have to deal with. And I also support a lot of people who are running digital health platforms. And there's a lot about marketing at the moment, and I'm sure you will all be aware of this, but the Advertising Standards Agency, GPHC, issued something only last week about clamping down on basically advertising of prescription-only medicine. So we have such a responsibility to the public as well.
Definitely. And Kamal, do you have anything to add on that?
Well, I was going to say, from the leadership perspective, I think it's really important that that we, digital advancements are here and they're here to stay. So we've got to stay curious and not necessarily always critical as the first point of call. And the other thing I would say is that we also have to utilize the technologies and use them ourselves in order to be able to actually understand how they operate.
Definitely. And back to you, Kamal. So through your work with female pharmacy leaders, what skill gaps are you seeing that pharmacists need to address to thrive in tech-enabled future?
This is a really good question, actually, because I speak to a lot of pharmacists about how they're kind of working with technology. And there's two key things here, and building upon what I said earlier, is we have to remain curious about the technologies that are coming up and that are available to us, but we have to also recognise the gaps in our own knowledge and have awareness of the digital literacy of the people that we work with. So, for example, if I'm working in a pharmacy, not everyone in my pharmacy is going to be as digitally literate as perhaps I might be, because I'm much more competent and confident with using digital technology. So we have to be aware of everyone's digital literacy and meet them where they're at and empower them and enable them to be able to use the digital technologies better. So I think that that's a really important skills gap, and I think it's really important also for companies like Tandem and others, coming into the space to recognise that digital literacy within pharmacy is going to vary quite significantly, even within a team. So from a leadership perspective, that's really, really important. And the other thing that I would say is that, we have to not only empower each other to use the technology, but we also have to recognise that this is a new world, it's a new landscape, and we have to really think about how is this technology being used in my pharmacy setting, whatever that is, and how is that going to change the trajectory of our roles within it.
Interesting perspectives, and thank you for sharing. So to each of the panelists, in one word and one word only, please, can each of you share what word excites you the most, or one word to share what excites you the most about pharmacy's digital future? Yasmin, do you want to start?
I would say access.
I would say Tandem.
I would say automation.
Say empowerment.
I'd say enablement.
And for myself, I'd say innovative. So, what is the biggest barrier preventing pharmacists from adopting new technologies? Thorin, do you want to start?
I think we've been through such a journey. It's actually great to be back here. So I was chair of the Royal Pharmaceutical Society and in England. And at one point we were just talking about the concept of a patient record, and we're getting there slowly towards, more of a shared record. But we do need to put patients at the heart of owning their records, I feel. So I think that's a challenge at the moment.
Definitely. And Tay, is there anything you wanted to add on that?
I'd probably say, going back to what you said about the digital literacy, I think when you're making these changes, I thought there's this apprehensive nature in our work. So I feel like with time and with education, I think that's when we've started to see the changes of, people being able to implement new, digital infrastructure into their pharmacies.
So it seems from what you were saying, it's all about the patient as well and making sure the patient is at the center of it. Thank you. And lastly, how do you see AI specifically changing pharmacy practice? Amar?
That's a great question. Wasn't one of the ones I was thinking of. I think it's actually interesting. I meet so many people who are at different levels of maybe adopting something. So you have a lot who are really keen to adopt it, and it's fine, it works fine. And then others who really feel overwhelmed by all the different solutions that are out there. And there's some fantastic teams. We see OLIS today, seeing a lot of different teams that have a really great offering. But if you can't bring yourself to get to the point of trying it out or giving it a go, or enabling yourself to try it, it's not going to really help you. So I'd say start off small. Like pick one tool that automates a really menial and difficult task in your workflow and then expand from there. So if you really find note-taking difficult, you should try Tandem. And with the integration that we have, you'd then be able to automate the parts of the job that you really shouldn't have to waste your time.
Thank you. And Yasmin, do you want to finish us off?
Yeah, that is a really, really good question. I guess right now, on a practical level, where AI is actually being used is through the patient medication record system. So you've got a lot of robots that are being integrated in community pharmacies. They're using a lot of automation, and it's using AI to pick out the patients that you need to be seeing first, or even to a point that if someone comes into your pharmacy, you've already been told if they're eligible for, a hypertension check, a blood pressure check, like a lipid check. You can tag on all of your services to maximize your deliverables to the patient, but also your profit margins as well, because every service counts, right? So, so that's where we're seeing it right now. And then later on, I think, it's just going to be a mainstay of the way that we deliver pharmacy practice now. And one of the things I would probably add on is that as pharmacists, as pharmacy students, we have a huge onus to understand what those models are trained on. Sorry, I'm digressing slightly, but this is really important. Essentially, the way that AI works is trained on data. All of us need to be aware what that data contains. Is it biased? Is it representative? If it's starting to give clinical advice, is it biased towards a certain group, and all of those things? And I think that is an added layer of education that we can add to our tool set to make sure that we're protecting our patients and not widening the gap of health inequality and socioeconomic deprivation through digital usage.
Wow. What a finish. Thank you. Let's give a round of applause to our amazing panelists.